Hey class, today we're going to cover the last major part of the gross anatomy of the muscular system. Today we're going to focus on muscles of our lower limbs. So let's go ahead and get started. So a little bit about muscles of the lower limbs. These are going to cause movements of our hip, knee, and foot joints. A lot of these are going to be some of the largest and strongest muscles of the body because they are going to support our major function of walking, running, jumping, and those kind of big, powerful movements. Again, just like I did with the other sections, I'm going to include this chart that comes out of the textbook that I teach you that shows you a lot of the names. Again, the origin, remember this is the immovable part that it connects to. And then the insertion point, which is where this is the movable part that the muscle connects to. And then what is its primary action, such as flexing the knee, adducting the thighs, flexing the thigh, etc. Again, here is another image of muscles, origin, insertion, and their primary action. I've also included this image as well in case you just need an overall view. And then the posterior view of this image again as well. So let's get into these muscles. We're going to first focus on the hip. There are two major muscles here. The first is the gluteus maximus and the next is the gluteus medius. Again, most of you guys know that your gluteus is going to be your butt region. The gluteus maximum is the superficial muscle of the hip and it actually forms most of your buttocks. This is a very powerful hip extender. And it also helps bring the thigh in a straight line with your pelvis. This is also a very important muscle when extending the leg when you climb stairs or whenever you're jumping. So if you're squatting down, it helps you stand up as well. Gluteus medius, this is actually kind of beneath the gluteus maximus. Medius just means it's a little bit smaller than the gluteus maximum muscle. This runs from your iliac crest. So your iliac crest, remember, is on your hip to your femur. This is a hip abductor, so it helps draw your leg away from the midline of your body. It also is very important for steadying your pelvis while walking, and it is a site for intramuscular injections. Similar to what we learned about the deltoid in your shoulder, this is another spot for you guys to be able to get different kinds of shots. So if we're looking at the image of this, we have our gluteus maximus, and then here we have our gluteus medius. And typically when they give you your shots, if you've ever had them, they're going to try to feel for the iliac crest or the top of your hip bone. And then over here, this is the safe region where they give you a shot. And so you're going to notice it's going to be in your gluteus medius area. Other two muscles in your hip, we have in your lower limbs is going to be your adductor muscles. This forms a big, huge muscle mass on the medial side of your thigh, and this helps adduct or bring your thighs together, such as if you were trying to ride in a saddle of a horse. Muscle number 4 is your, I can never say this right, so iliopsoas. This is composed of two muscles. This runs from your iliac bone to your lower vertebrae, and remember your vertebrae are the bones in your back or vertebral column. This is important for flexing the hip, and it helps keep the upper body from falling backwards when we're standing erect. So if we're looking at these two muscles here, we're going to find our iliopsoas right here. Again, it's formed of two major muscles. And again, it's located here. It's going to be attached to your vertebrae and down into your thigh, again, so you do not fall backwards. And then the other one that we focused on was our adductor groups. Again, this is going to be in your inner thigh to help adduct your legs. Next, we're going to focus down towards your thigh versus knee region. First group we're going to focus on is the hamstring group. We're not going to learn the 3 individual muscles, just know that they are composed of 3 muscles, your biceps femoris, your semimembranous, and your semitendinosus. This is going to be located on the posterior thigh. Remember, posterior means the back side of your thigh. This functions as a prime mover of thigh extension, so straightening out that leg, and knee flex or thigh extension, and then knee flexing, so bending that knee. This is actually most common injured muscle, specifically biceps femoris. I went to high school with a kid who did not stretch properly before exercising or doing a track meet in cold weather, and he actually pulled his hamstring. The next one is your sartorius. This is a very thin and strap-like muscle. It is very superficial, but you don't normally see this muscle on somebody when they flex unless they're like a bodybuilder. It is a very long muscle, so it's very weak, and it actually helps us sit cross-legged. And then our third group, before I show you them on the pictures, is our quadriceps. They're named this because they are a group of 4 muscles. They help cross our hip and knee joints and help flex our hip. They also help extend the knee very powerfully if we wanted to, let's say, kick a ball. So if we're looking at some of these, this back side, this is a posterior side. Here is our hamstring group. Again, it's going to pull back our knee and our leg as if we're going to kick a ball, and it helps flex that knee. If we're going to look at the front side, here, this strap right here, this long strap, is our sartorius. Again, you don't really see this when people flex unless they're bodybuilders. It's not a very strong muscle because it's so long, it's really weak. And then we have our quadriceps, which is a variety of muscles here in the front. The most commonly and most known one is your rectus femoris. Also here in that muscle, this is typically where we get another site of intramuscular injections, and usually things that go here are things like EpiPens for a big adrenaline booster. Now we're going to focus on muscles of the lower limbs near our ankle or foot region, so we're going to find them in our tibia fibula region. The first one is your tibialis anterior. So again, tibia is going to be near your tibia bone, anterior on the front side. This is our superficial muscle on the front side of our lower leg, and it acts to dorsiflex. And remember, dorsiflex means point your toe upwards and invert your foot. The next one is the extensor digitorum longus, and just exactly what the name sounds, digitorum means it has to do with your toes, and extensor means it's going to extend your toes. So this function is the prime mover of toe extension. And then we have fibularis muscles. Again, the name says that it's going to be near the fibula. These are 3 muscles. We have the longus, brevis, and tertius. Brevis just means short. This is going to be found on the lateral part of the leg near where your fibula is located because they arise from your fibula. This helps do your plantar flexes, so pointing your toe down, and helps evert your foot. So just to kind of show you where some of those are, we have our fibularis muscles right here. We have our longus and our brevis and our tertius, so these 3 muscles along the side. And then we have our tibialis anterior, so this is your muscle right here in the front, right next to your tibia bone. And then your extensor digitorum longus, we're going to notice, is kind of right smack in the middle of these 2, and you're going to see that it kind of extends down into your toe region. To go over to the last 2 muscles that we'll talk about, we got the gastrocnemius. This is a 2-bellied muscle. This is most commonly known as your calf because it forms the curved calf that we see on the back of our leg. This connects into a major tendon that most of you guys have heard of. It's called the Achilles tendon. The true name is the calcaneal tendon, and this goes into the heel of a foot. This is a prime mover of plantar flexion, which again, we call this dancer's toe because that's when you point your toe down or you go up on your toes. The last muscle is soleus. This is deep to the gastrocnemius and it arises on the tibia and fibula. It doesn't really affect knee movement, but it does have a strong function in plantar flexor of the foot. So again, if we look at this image, here we can kind of see our gastrocnemius muscle in the back here. It's not really labeled, but we can see it protruding out on this anterior view. But where we see it a lot right here is in the back. Here we see it, two big, huge belly muscles that form our calf. And then here's our soleus that we were talking about. So over here, kind of on the side. If we were looking at on the front, they do have the soleus muscle located right here in the front as well, if you kind of wanted to see that front anterior view. Again, this is the end of the lesson. If you have any questions, please make sure you ask, and I hope you guys have a great day.